Thank you. Thank you, Professor Niranjan Khalsa and Professor Chappell, to have me here at Loyola Marymount. And sorry, Dr. Chaudhary is probably still enjoying the lunch, but there was no mutiny, so we started half an hour late because they did the right thing with the food. Thank you for the healthy food. Amongst all this Ayurvedic, what are these all MDs doing here? And now that we have heard about the brain and the gut, I think there are some other essential organs left. So that's what we're going to touch. And before I bring our first speaker, I'll tell you about myself. And before that, I hope that we begin with a laugh, and I promise you we'll end with a laugh after an hour. In between, I don't know, because I put people to sleep. I wake them up and then send them my bill. And if you don't wake up, I see you in ICU. I'm an anesthesiologist and intensivist. I am professor at Loma University and chief of surgical ICU at Long Beach Veterans Hospital. Moving on to, so we're going to take care of heart, talk a little bit about kidneys, and probably one of the two most common diseases in the world, diabetes and high blood pressure. Come back again with the heart, and then a surprise from me. So first we have Professor Rahul Naveen Doshi, and he is an associate professor of medicine and director of clinical cardiac electrophysiology. When our heart goes haywire, he tries and helps to fix that. Works at USC, has a degree in biology from UCLA, and did his MD from Stanford. And his interests lie primarily in complex procedures and new technology in clinical electrophysiology. Ladies and gentlemen, give it up for Dr. Doshi.
So thank you very much, Dr. Shah, and thank you, Chris. It's a pleasure. It's a pleasure being here. I have to, of course, make the few disclaimers. First of all, for those of you who don't know, on the black market, you can get the coconut for about $1.99 on eBay. I don't know that actually that was probably the best introduction I could have possibly come up with in terms of why I'm the least qualified person to be up here at this podium, and not just because I'm the token ABCD on the panel. That's American-born confused Deshi, for those of you that don't know. But as my father has been telling me since starting medical school, of how I've been constantly focused on Western medicine and how we tend to dissect things further and further and further and sort of negate or ignore, rather, the holistic view. And it's especially important recognizing that you have somebody as preeminent as Dr. Schneider here, who I very much enjoyed your lecture, and it's probably one of the reasons why my dad is thinking that I'm such a failure right now. So, so thanks for that. So, those of you that don't know, my father actually, it's a little ironic, he's actually an engineer, as you heard, and he was actually what you would call a metrologist, which means that he spent all of his time back in the days of TRW looking at little finite measurements and acoustical electronics in aerospace. And so maybe this is his revolt at trying to look at something on such the microscopic level. And so my own revolt then would be, of course, cardiology wasn't enough. As you heard, I'm a cardiac electrophysiologist. So I had to specialize even further. And so I specifically only look at, if you will, arrhythmia disorders, electrical disturbances of the heart. Now, you've heard already in Dr. Schneider's talk a little bit about some of the effects of things like transcendental meditation on hypertension and overall cardiovascular health and morbidity and mortality, which is pretty much the ultimate and endpoint, right? What I wanted to share with you today, on a very microscopic level, if you will, is that even in a field as specialized as mine, I think there are some degrees of coming full circle, as it were. And so I wanted to speak about something called atrial fibrillation. So I'm going to take a chance here. So looking at the age of the population. So how many people here in this room have atrial fibrillation? Okay, so that's about right in terms of population. And I'm sure if I say how many people know somebody who has atrial fibrillation, we're going to have a lot more hands, right? So this is a pandemic disease. It's not so easy to say that, oh, this is confined to my little subspecialty. Atrial fibrillation is the most common arrhythmia in the world. It affects 2 to 3% of the population over the age of 60. And so a huge problem, and it's associated with all kinds of morbidity and mortality, right? So people don't feel as well, people die as a result of the disease. Now, I spend the vast majority of my time in clinical practice or in my time in training fellows how to deal with this disorder, because it's the bulk of any electrophysiologist practice and is actually a large part of any cardiologist or even general internist practice because of its prevalence. And I will also tell you that as somebody that spends most of my time moving catheters around in the heart, buzzing areas that are responsible for these arrhythmias, what we call catheter ablation, which is a very sort of microscopic and sort of finely dissecting type of procedure. It's not obviously a very holistic approach to the disease. I will tell you, as somebody who does this all the time, there are severe limitations of our therapy. And I will say that even though I'm often very happy and satisfied with what I do, our treatments for such a multifactorial disease, which atrial fibrillation certainly qualifies, right? So we know it's related to things like structural heart disease, you know, if you have coronary disease, if you have a valve problem, if you have high blood pressure. If you have a genetic component, so we're learning more and more about these. And so again, our approach has generally been to try to dissect this further and further and further. To try to understand, okay, so if I can identify this particular ion channel disorder of a cardiac ion channel that's genetically inherited, maybe I can direct my therapy toward this. Or if I can understand why this particular anatomic presence or discrepancy or change is present in a particular individual, maybe I can target my treatment. But it's also been known for quite some time that some bigger step back or more holistic approaches to atrial fibrillation can be effective. So in fact, there's data going back now 10, 15 years about the use of things like hypnosis for the treatment of atrial fibrillation in the perioperative period. People that have bypass surgery often have atrial fibrillation, in fact, about a third of the time. And if treatment like hypnosis, trying to mediate stress and all the subsequent mediators that are a result of that stress, can decrease that incidence of atrial fibrillation in a very acute setting. There's been data even using things like acupuncture for patients with both paroxysmal or intermittent atrial fibrillation and persistent atrial fibrillation, people that are in it all the time. But actually a colleague of mine at the University of Kansas, a guy by the name of Dhananjari Lakireddy. So DJ actually did a study a few years ago looking at the effects of yoga on atrial fibrillation. And so it was a very straightforward study, a fairly small study if you're talking about cardiovascular disease, right? All of our studies are usually pushed forward with thousands upon thousands of patients. But in a small series of patients, where patients served as their own controls, he took patients that were already being theoretically optimized or theoretically being ideally treated for their atrial fibrillation, but they still had intermittent atrial fibrillation. And the reason, or the reality is, that as good as our treatments may be, they're not completely effective, right? So if I look at most of the drugs that I would prescribe for somebody with atrial fibrillation, as far as trying to keep them out of it, they're only effective about 30 to 40% of the time. And if I look at some other medications, or one in particular, that is more successful at controlling the arrhythmia, as you've heard in some of the other talks related to sort of our pharmacologic therapy, there is a whole host of adverse side effects that can actually be life-threatening. And so there are problems with our pharmacologic therapy, which is the reason why techniques such as what I do all the time, catheter ablation, have kind of taken off and are more successful than drug therapy. But they're still only successful with an invasive procedure that requires general anesthesia, several hours of procedure time, and then some period of recovery, maybe only about 60, 70% of the time. So we have a long way to go at trying to get ideal therapy, right? So DJ did this study where he actually used patients, well-treated, monitored their AFib burden, both from their own standpoint, what patients were feeling, and used objective monitoring with ambulatory monitors, right? We have all these kind of heart monitors that you can hook up to folks and monitor if they're having any particular arrhythmia. And what he demonstrated that 2 60-minute sessions a week of Hatha Yoga, Iyengar Yoga, actually decreased the incidence of atrial fibrillation, so objectively, as measured by ambulatory recordings, by about a third, which is very, very powerful. If we look at most of how many of you are on statin therapy for high cholesterol, right? So a lot of folks, right? And so that may decrease your risk of having a heart attack by only a few percentage points. From a population, it's important to treat. But when you talk about absolute differences as compared to relative risk reductions, it's important to keep these straight, right? So I found this very, very interesting, and then I would just conclude, since we're limited in time here, that there are more folks, so-called proceduralists or ablationists in my line of work, that are adopting more holistic approaches to the treatment of this disease and incorporating it into their practice. One of the busiest catheter ablation physicians in the world, a friend of mine by the name of John Day, who actually himself has done a whole huge amount of work that was based upon his earlier experiences on when he was on his mission. He's Mormon in Salt Lake City. He went to this village in China that has the longest longevity in the world, and actually is writing a book about this, about these practices in terms of its utility in cardiovascular disease and then just sort of overall health and longevity, the topic of this particular conference. So John actually, as somebody that used to do about 500-600 ablations a year, is actually now moved his practice toward instituting these type of therapies first before prescribing these more sort of invasive or advanced techniques. And I would just surmise, and I'm curious to hear what the rest of the panel would say, that there may be an overlying, or an underlying, I should say, hypothesis is why this all works. Because, the scientists in the room would say that, well, okay, sure. You might meditate, you might do yoga, and that might actually cause you to eat right, be healthy, lose weight, lower your blood pressure, as we're going to hear about some more. And these all are things that do affect the incidence of these type of arrhythmias. Well, I will tell you that a large population I see, since USC is the center of all things sports medicine because of its preponderance, or I should say fondness for all things athletics, right? Yeah, I'm a UCLA alum, by the way, so so there is absolutely no doubt that a large population I see are the highly competitive endurance athletes, and it turns out that middle-aged endurance athletes, though they are healthy from a cardiovascular disease standpoint, right? These folks don't have coronary disease. They ride a century every other day, right? But they have a huge incidence of atrial fibrillation. About a third of them do. And so it's not just as simple as saying that I'm going to eat right and be healthy and I'm going to have less disease. It's a lot more complicated than that. So I would surmise that this whole hypothesis underlying inflammation and effects on things like T cells, as we had heard the comment earlier, or things that help us fight overall disease. Stepping back and looking at some of these multifactorial diseases, a more holistic approach might be in order. So with that, I would turn it over to the next speaker, and thanks very much for your attention.
Thank you very much, Dr. Doshi. Sorry, ma'am. We're going to hold all questions till the end. Please make sure to write them down because we need to have enough time for all speakers. My apologies, but we need to move on to Dr. Anjana Kamdar. Let's protect our kidneys. Is there anybody who didn't go and pee in the break? You should have. She's a nephrologist and internist and a medical director of hemodialysis and peritoneal dialysis at White Memorial Medical Center. But what's most important is she emphasizes healthy eating and regular exercise as ways to prevent variety of diseases. Dr. Kamdar.
Thank you, Dr. Shah. And thank you, Dr. Chappell, and Mr. Doshi, Pratima, for creating this conference that is almost transformational in thinking about how to treat various diseases. World Health Organization, WHO's long-standing definition of health is a state of complete physical, mental, and social well-being, and not merely absence of disease state or absence of disability or infirmity. Modern medicine is based on scientific knowledge or is called evidence-based and has no parallels, I think, in treatment of acute illnesses such as acute life-threatening infections, bone fractures, acute appendicitis, electrolyte imbalance, ketoacidosis, etc. Western medicine also has provided many health-related benefits in chronic diseases such as diabetes, hypertension, chronic kidney disease, and cardiovascular diseases. Hypertension, if we look at hypertension, it is insidious or asymptomatic, and unless the patient has gone to the clinic or somewhere to measure the blood pressure, he's not aware of it. And if untreated, will lead to many complications of kidney failure and heart failure and other complications. It just reminds me that one of the first Ayurvedic medicine that was used to lower the blood pressure was Sarpagandha that we heard yesterday from one of the speakers. And I remember Dr. R.J. Vakil in KEM Hospital in Bombay in India, which is my alma mater. He used the Sarpagandha on many patients, and from his observational studies, as he showed very good results with that, C. Bagaidi later on made Sarpacel and made millions on it. So we have known the Ayurvedic medicines or plant medicines to be working in many diseases for a long time. We also know that yoga and meditation will lower the blood pressure. However, if they were not taken care of, for me, in my specialty, it will ultimately result into kidney failure, and then patient will need dialysis. A lot of us are familiar with dialysis, so with the device, with the dialyzer, we will do peritoneal dialysis, hemodialysis, and when possible or as possible, we will proceed to kidney transplantation. Dr. Doshi has also mentioned how so many devices can be used for cardiovascular complications. So what it shows to me as in treating physical illness, Western clinical care is almost unparalleled. It surely is successful, and surely comes to some kind of solution, if not completely curable. However, for centuries, physicians, patients, and other healers have known that how illness brings attention to relationship with self, family, society, nature, and the sacred. Illness will raise questions on meaning of life, on purpose of life, and on transcendence. This focus on spirituality or this focus on consciousness is not part of the Western or modern medicine. It is not within its realm, and it's not in its spectrum. And that is the void that we are trying to fill. It's the void, it's the gap, it's the lack that we are trying to explore. I believe that yoga, meditation, mindfulness, sattvic or healthy diet, they need long-term practice. It cannot be condensed into a pill form and taken on the need basis. These practices are important promotional activities just as non-smoking, vaccination, and cancer screening are. All of them enhance spirituality and result in peaceful being and patients' well-being. We use these practices already, even though the data might be lacking behind in dialysis patients. As they go on dialysis, there are several issues that are uncovered, especially such as depression. And we use the yoga and the meditation therapy for this group of patients to control or to resolve their depression, the suicides, and the sexual problems. This energy form, one has to commit to practice to maintain the health. It is a long-term approach and needs to be understood in that fashion. The Ayurvedic health system has many therapies that can be used as an adjuvant therapy and not as an alternative therapy to the conventional medical care. And today, in the past 2 days or 1.5 days, we've already seen many such data from other speakers, how it is helpful in treating the various forms of diseases. Now, in order to globalize the Ayurvedic health system, it faces some challenges. If we have to present to other countries or more developed countries, if we say, and integrate it into the current practice of medicine, it will have to build data on safety and utility of drugs. It will have to do standardization of drugs. It will need multi-center, randomized, placebo-controlled trials. It will need international collaborative studies. It will need communication of these things to other nations, need translation of the knowledge into other languages. So in that terms, it's quite a task. However, a conference like this, with the help of Pratima and Naveen Doshi and LMU and Dr. Chappell, it's like a silver lining. I can see that the growth or growth or making of the Ayurvedic institutions will help promote these ideas further and be helpful for all the treatments possible. Thank you.
Thank you, Professor Anjana Ben Kamdar. We move on to Dr. Vikram Kamdar, who is an endocrinologist, clinical professor at UCLA. How many people did not, I repeat, did not eat the cake today? Oh, wow, quite many. Sorry, Dr. Kamdar, your business may go down. Yeah, he's going to talk. He's an educator, researcher, and highly sought after public speaker in the field of diabetes. And his interests are diabetes and premature coronary heart disease in South Asians. Dr. Vikram Kamdar.
Thank you, Dr. Shah, Pratima Ben and Naveen Bhai for making this happen, and Chris and Dr. Khalsa for doing this wonderful job. I think we all are learning a lot, and I think we have a lot to assimilate, and I think future health of the people is definitely going to be better, and I'm quite sure about it. So coming to the definition which Anjana told us about the WHO definition, but if you read the definition of Ayurveda about health, they have included all those topics, but included spirituality. And that was emphasized during the earlier talks, and I was so pleased to hear about that. Now, being trained in Western medicine, but going back, I grew up in the family of physicians. My father was general practitioner, and I think he had treated quite a few people who are here in this audience. And he had a ritual that every weekend he used to meet with his friend who was a Vaidraj or an Ayurvedic practitioner, and they used to exchange their difficult cases, and there was a collaboration which was going for a long period of time. And that's where I learned that have an open mind, and I think that has helped me a lot. Grew up with the Western medicine where I learned physiology, which is the normal functioning of the body. Then the disease sets in, and there are disturbance of the function. So there is a pathophysiology. And what are the causes of that pathophysiology? Those are the causes which we call is etiology. And then you have to diagnose that with a physical examination. And now we have some more objective evaluation with some of the laboratory and the other testing, make a diagnosis and start treating. In acute care, of course, the Western medicine has, as mentioned earlier, there is no match to that. For chronic diseases, we are still behind, I should say. What most of the treatment which we have is just symptomatic therapy, and probably the nature is healing itself, and that's what happens in most of the time. And that is very true. And regarding the next part, which is the prevention in Western medicine, is very early. I, being a diabetologist, the diabetes prevention program or prevention trial, those were done at two places. One was in Scandinavia, and the other one was in the United States. The change in lifestyle led to 55% reduction in the development of diabetes as compared to metformin or no treatment. That tells us the change in lifestyle is so extremely, extremely important. And if it was started from very early, it would prevent diabetes. Now, being a diabetologist, I always have my first sentence that in my textbook of medicine, I was told, if you know your diabetes well, you know the half the textbook of medicine, or almost 3/4, because all the complications which happens in diabetics, it involves every organ system of the body. And if that is the case and the expense which it leads to, what we need is a prevention, prevention, and prevention. And coming back to my all the learning with physiology, pathophysiology, I have now learned that there are ancient wisdom, but we have to put the modern explanation for that. And I was so pleased to see today that a lot of evidences, the scientific evidences were presented regarding blood pressure, regarding the brain stimulation, brain-body connections. And I'm so pleased because that was something, because I can always have a hypothesis, but here we are having the scientific proof. And I'm just it was a music to my ear. And I was very happy, and I really congratulate the science and as well as the presentation of all the things which you had mentioned. For many, many years, I have been thinking that one thing which was always emphasized, being a diabetologist, and there are 47 million diabetics in India, okay? Very large number, and it's going to be 65 in 2030. And if you want to take care of all of them, all the progress India is making economically, it will go in the care of the diabetic patients in India. That's going to be the future, but that is the unfortunate part. But here if you see, what are the two exercises which are always emphasized, and that is Surya Namaskar and Baitak, Dand and Baitak. Look at those. The back muscle, the gluteal muscles, and the shoulder muscles, which are the largest muscle masses. The first step in the development of diabetes is resistance of insulin to the muscle. If you maintain the muscle strength and exercise, you are postponing diabetes. That was the first preventive aspect, and I think we should have a trial where a pseudo, like just running versus this kind of exercise, where all these muscles are being trained, and if we have a better outcome out of that, that will be a big step forward. The second part, we have pranayama, which is deep breathing, where we are stimulating vagus. The vagus nerve, which is parasympathetic mimetic or parasympathetic nerve, which improves the insulin secretion. The other first defect in the development of diabetes is the first phase of insulin secretion, which gets inhibited. If you have a good vagus tone, you are maintaining the first phase of insulin secretion. And this is my hypothesis. I would like to get it tested someplace where you do that, or a person who has early first phase insulin secretion defect, ask them to do pranayama and see if the first phase of insulin secretion comes back or not. And that will be another great research project for the younger people. And I think we talked about the treatment, and that is the evidence-based. So the prevention part is that. Now coming to diabetes and atherosclerosis, the South Asian Indians are having highest number of premature coronary artery disease. We have that atherosclerosis, which is related to insulin resistance, plus there is inflammation. And all the various drugs, not the drugs, but some of the natural substances which are available to us, they are mainly antioxidant and anti-inflammatory. So we have definitely a chance to postpone and prevent atherosclerosis, development of diabetes. The third area which I'm also quite interested, and that is the vitamin D deficiency, because vitamin D, which improves the immune system, but the second part is the muscle strength. And when my grandson was born, I was just thinking, what is he missing, which he's missing here, what he would not have missed in India? That during first 6 months, they all get oil massage, and oil contains vitamin D, and that vitamin D, if it is getting absorbed, and if it is preventing the infection, and that is the best way of preventing infection, and that is something so wonderful. And I think these are some of the things. And I was told by a friend of mine who is at NIH that they are starting a trial where there is a Machimar community or fishermen community where for first 6 months they are applying the fish oil to the newborn, and they are studying the rate of infection in the other group, where if the infection rate is less or not. So this is the ancient wisdom. And now we have to make modern interpretation. So I asked my friend who is at NIH and giving this grant to measure vitamin D. Is there any increase in vitamin D in this, which is preventing all these problems? And I think there are ancient wisdom, and now we have to make modern hypotheses, and that has to be proven at the universities. And we have about 10% of all the medical school students are South Asian Indians. I should tell them that do all these studies, put this ancient wisdom into the scientific world so that people start respecting that ancient part also. So I am very, very happy to see this objective proof. We are having hypotheses which needs to be proven. But this most important part is to respect our old ancient wisdom, and let's put it into the perspective. And healthcare, or we are professionals, we want to see that our patients are better cared for, they are happier, and they are not drained into the enormous expenses of this modern medicine, but these are the preventive aspect which can really help them. I'm going to stop here, and thank you for giving me this opportunity.
Thank you very much. Our next speaker is Dr. Harvinder Sahota, Jain, as he likes to call. He is an inventor of perfusion balloon angioplasty. And not only United States of America, but he performed the first one in Mexico, India, and Moscow, Russia, years ago. So at least he was invited there. I don't know about now, but he's got many patents to his name, guest speaker at many places, recipient of many awards. And lastly, with all this that he has gathered, he also established a chair for Jain Studies on his mother's name at University of California, Irvine. So with that, Dr. Sahota.
Thank you for the opportunity. Now, I will start first saying that whatever has been said yesterday and today, I fully agree with all those things. In fact, I think there is so much talent I have seen since yesterday and today that this group should be making the health plans and health services of this country. And the chairman and vice chairman of that health service should be Chris Chappell and Niranjan Kaur Khalsa. Because they are good organizer. If you think this conference was organized very good, then they should have the opportunity. Now the main, I also have a challenge for all the presenters here or everybody, especially those who are of Indian origin in this country or came from India, because since last 5-6 years I have been working with different universities in this country, and they say there should be openness, challenge, opinion, counter opinion. So here's the challenge I throw to those Indians in this country or Indian in India to find out that why did this Ayurveda thing and yoga thing disappeared from India? Because I heard over here 5,000 years ago, 2,000 years ago, so-and-so did it, all kind of thing. Then I wonder why it was disappeared from India. We should still be practicing. In fact, if at all I hear only in these countries. So is it a cultural difference? In fact, where West is going away, India is going into it. Now here we are educating our young people, and from a health point of view, don't eat a burger, don't eat pizzas, don't eat French fries and sodas. But in India, people are very keen to go and eat these things with pleasure. I was earlier on talking with Mr. Doshi also that India should and other developing countries should learn lessons from these countries. And if something which has not worked for these countries, they should not let them come over there or get popularized there. Yeah, I do believe prevention is better than cure, and so prevent and learn the lesson from others. Now, the theory about the young Doshi asked, why is it the yoga helps? My theory, this is a Sahota theory, that it's because the stress. I think yoga helps by removing stress. So, and over the last 25, 30 years, I have given lectures all over the world, and mainly talking about the risk factors of the cardiovascular disease. I used to start with genetics, then smoking, and then blood pressure, diabetes, cholesterol, that kind of thing. But since last 10, 15 years, I've replaced the number 2 thing. Instead of smoking, it's the stress. And stress has been linked to all kinds of diseases in human being, and most of the causes of stress are like somebody has a job stress, financial stress, children's stress, or that kind of thing. But for this area, this is reported in medical journals, even in cardiology journals, the most important stress in this area is driving around in Los Angeles. So if you want to remove the stress, stop driving. I always say freeways are never free. So I think to remove stress, we have to remove these causes. That's the best way of removing the stress or any other illness or disease. You go after the cause. And there are a lot of different ways of doing it. One of them is the yoga. If yoga helps it, that's fine. I have been practicing this. Now, today I learned it was yoga, and without realizing it was yoga, and I have been telling my patients about the stress, whatever it takes, and I think yesterday's speaker said, Satnam Vaheguru, and if nothing else, that's good yoga. So meditation, you can say it. So I think that's the thing. Now, talking about the rest of the things that Ayurveda, how to improve health and that kind of stuff, I think there is a conflict. We have created this life and complicated it with the modernization, so-called progress, so-called advancement. Some of them are good, but all of them are not good. So if you want to stay healthy naturally, you should buy a farm, get a cow, grow your own vegetables and fruits without any fertilizer, without anything. Get up in the morning, have a fresh air, go to the field, get these things, cook them. So I think, let me see. How much time? Stop? We can stop? Oh, I am asked to stop.
No, I'm not. He has given us the best, so we don't need anything else, sir.
Yeah, maybe we can use that time for question answer for others. Thank you.
Thank you. So, Dr. Sahota ji, I'm ready to move in your farm, sir.
Okay, you are welcome. Everybody else is welcome too.
Thank you.
We'll all go to Gardiwala. Yeah.
To keep in line, I thought I'll give you some slides also. I'm the last speaker, by the way, and I promise you there will be time for questions. And I'm going to come to you first, lady. And at the end of my talk, if you say, we saved the worst for last, I will not feel offended. My apologies, I wasn't here yesterday and early part of this morning, but I am pretty sure that this is something that was not talked. And I'm going to run through a little bit fast, but what do you think about this? Thank you, at least I have the approval from Chris. This is a topic very dear to me. I've been talking to community people as well as my hospital, and as an intensivist, I've seen it very closely. So I'm going to try and give my version. Will you still need me? Will you still feed me when I'm 64? Well, this is what I say now. Will you still need me? Will you still feed me when I'm 97? How about this? Well, great silence, right? Believe it or not, I would say 90% of the time it is true in my ICU practice. I'll not go into the details, but 92-year, what is America, or what is it that I have seen? And these are some of the cases. 92-year-old female for cervical laminectomy, here. Severe Alzheimer's disease. Has not recognized her daughter for 3 years, her granddaughter for 5 years, and still they want surgery. And these are all cases, by the way, I have been able to successfully avoid what they otherwise were trying to go through. And it's not that I'm only in favor of aged, but 29-year-old develops breast cancer, has a lot of therapy, radiation, chemotherapy, etc., in remission. That's very, very important. But 4 months before, decides that enough is enough, and I'm going to accept my destiny, passes away very peacefully at home with her family in her own bed. 50-year-old female with hip fracture. She has got metastatic breast cancer, nothing that allopathy can offer her as a cure. We certainly, by the way, can keep people alive for months and years and generations. No, sorry, but years. Limited functional status, and I could convince her that it's not worth her while. Cost of dying. 2009, Medicare paid $55 billion just in last 2 months, and 30% of those had no meaningful impact. There is a story in 60 Minutes by Richard Mayers in December 2010. How much do we spend in end of life of care in 2015? 1% of the population accounts for 30% of the nation's health care. If you save this money, if you put numbers together, which I have not, but my guess, if we use that money to feed people, probably there will not be any hungry person in the world. 40% of Medicare dollars cover care only for the last month. 2010, another study by USC colleague, Dr. Ken Murray. Doctors die differently. It's not like the rest of us, but it should be. Charlie, an orthopedist, found a lump in his abdomen, pancreatic cancer. Probably, almost probably, that is the worst cancer to have, because it's so complicated that the diagnosis is very late, and because of that, there isn't a whole lot of treatment that one can offer. He chose not for any treatment. Remember, he was an orthopedic surgeon. Torch, lung cancer, gone to his brain, 4 months with chemo, and he decided not to have that. Died at home 8 months later, cost to Medicare, $20 for those 8 months. So this is in the Journal of Medicine, and these are the reasons. Doctors and patients are simply victims of a larger system that encourages excessive treatment. We are partly to blame. In some, doctors use the fee-for-service model to do everything they can, no matter how pointless, to make money. More commonly, They are fearful of litigation, and I believe in this a lot more. And my own self, my practice in America is a little different than outside. And I go to many countries, do missions, etc. And then I practice in India and Africa. So, yeah, you do have to worry about standard of care, common practice, what happens in the community. We forget there is an individual with a question here. And whatever happens to that individual is 100% for that individual. Missing is death with dignity. People placed in hospice care, they live longer than otherwise. Hospice care, which focuses on providing terminally ill patients with comfort and dignity rather than futile cases, provides most people with much better final days. There was a conference in 2012 that I coordinated in 2000 at Claremont Lincoln University. It was about bioethics, religious and spiritual perspectives. Today's conference, and I was interviewed at that time by Steve Lopez, and I'll come to that in a minute. University of Hawaii Professor Emeritus Cromwell said, Ars Moriendi, the art of death, written in the time of killer plague, concluded that death was not something for Christians to fear, but we still do. I would prefer to go out on a cloud when the time comes, preferably with a fast-acting doctor-prescribed medication, and will be less of a burden on loved ones. Not easy. He interviewed me for 1 hour and then wrote a front-page article in the LA Times in 2012. And this is what he said. For Judeo-Christians, the body is the temple of the soul. So you want to maintain, protect, and keep the temple going as long as possible. This is what Whitney Brown from there said. Whereas with Jains, Hindus, and Buddhists, the body is a prison of the soul. So you are trying to extricate your soul as quickly as possible. Death is followed by immediate rebirth. And I'll touch on a Jain way of dying, believe it or not, and it goes beyond 5,000 years. Jain religion has no beginning and end. It's been there forever. Around 4 years, recently challenged in a state of court in India, thanks to the westernization of India. By the way, Dr. Sahota, the Ayurveda is still practiced in India, actually. We talk more in the Western world and practice less of it, while in India there are still practitioners of Ayurveda. To do select now, one takes approval when her time is up from a priest, pastor, guru, and family, and first gives up solids, then liquids, water, and finally the inevitable hits. Kaiser Healthcare, 2.6 million Americans die every year. Dying in America, too many people end up having aggressive treatment that is ineffective and expensive and does not contribute to the patient's quality of life. This was in 2014 from Kaiser. New York Times reported in 2015, Medicare will pay doctors for consultations. Now there is an incentive for doctors to do something because there is some money coming. The final rule creates new codes to pay for advanced care planning under Medicare physician schedule. And that is the end of my not so pleasant talk. For you to think and excite, the examples that I gave, 2 of them were actually my immediate family members. One my wife and one my dad. And I was fortunate that we all thought and talked and decided to die. Both of them died very peaceful at our home in their own beds and did not go through some of the things that is kind of has pluses and minuses. Anyway, that's life. I still have another minute of things at the end of question answer to make you laugh because I promised you, and I know this is kind of depressing, but that's reality. So now, thank you. We're going to start with the lady for the question for Dr. Dosi. Yes, I'll get this and they'll answer from that. My apologies again, but I had to follow the protocol.
I was just asking Dr. Rahul that there was an article that billions of dollars worth statin drug had been used, and after that they have given that statin was not that useful and it created many side effects, and it is US research only, that article. was published all over.
So if I can, I guess, restate the question. The question is about the use of statin therapy in particular. Yep. Maybe that's better? Yes. That close, wow, okay. If the question is largely around the use of statin therapy for cardiovascular disease, I think that, you have to kind of balance both sides of this, right? So there's no doubt that there is a huge amount of randomized controlled prospective data looking at the use of this particular therapy in the decrease of cardiovascular events, hard endpoints, myocardial infarction, heart attacks, and death. But you're right in saying that these drugs have a cost, right? And so, the side effects have largely been centered around something that is fairly subacute or almost insidious, right? They cause a great deal of muscle inflammation, myositis. And this can be, in fact, even without clinical manifestations, if you look at biopsy samples, for example, of people on statin therapy, if you take thigh muscle biopsies, for example, you can see markers of inflammation that may not even manifest as clinical symptoms, and patients can often have this sort of insidious feeling of just chronic fatigue or such. So it's not to say that these medicines may not have their place, it's just to say that they don't come without a cost. And I think you can make that same argument for most of the things that we prescribe, right? And then a lot of the things that we base our recommendations, and certainly our organizations, for us in cardiology, American College of Cardiology, American Heart Association, et cetera, they make recommendations based upon population medicine, right? So if you do a trial and you save whatever X percentage of lives or you prevent X number of events, that might be a good thing. It's like, why do you get the flu shot, right? So you actually may decrease an absolute percentage of people who get the flu by a small finite amount. But if you look at that in terms of the population, it's huge and has marked economic benefits at receiving, right? But it's not a particularly holistic approach. And so even Western medicine, for all of its failings, right, is starting to take that approach now. All these advent of therapies that are targeting your own individual genetics, right, you've heard a little bit about this today, I think, and trying to tailor therapy based upon your DNA, right, as opposed to mine or anybody else's, is probably the more appropriate response as we move forward into this next generation of Western medicine. So. Right, well.
Okay. All right, one more question. Okay, sir.
I have a question for all of the members of the panel.
Wow.
And I want to just briefly mention that since all of you have taken an oath to uphold the principles enumerated by Hippocrates or Hippocrates, I want to know whether it's either Ayurvedic medicine or Western medicine, why is everyone so preoccupied with symptomology and associativity? If something is associated with, that is not finding the underlying etiology of the condition or something that has an idiopathic diagnosis or has, in the common parlance, essential in front of it. For example, essential tremor, essential hypertension, and you can fill in the blanks after essential. Why is it that we are not investigating the underlying causes and mechanisms so that we can make better treatment plans and better cures and have better life quality?
We got it, thank you. I volunteer Dr. Kamdar for response.
No, I think your question is very, very pertinent. And as the question was asked, that all the studies say that there is a decrease in the heart attack by 30 to 50%, but why the other 50% did not respond? That is always the question. So, and now we are learning in Western medicine that we have now the analysis of the genes, and now we are going to have therapy according to those genes. And also it was mentioned that there is gene analysis, and then there is a certain aspect which is the environment which is causing the thing. And whenever we say essential, that tells us more about our ignorance, because we have not gone in depth enough to find out what are the other causes for that. And that's where I put a great credence to Ayurveda, or observation or observational science, where they divided Prakriti into Pitta Prakriti, Kapha Prakriti, Vata Prakriti. In Western medicine, we said ectomorphic, mesomorphic, endomorphic. And that is a kind of a profile that this person has these genes. So certain diseases will be more prevalent. There are more treatment which we should be given to the Pitta Prakriti person, Vata Prakriti person, or the Pitta Prakriti, or the other third degree person. So I think we are perhaps West, with the analysis of this kind, we are going towards more specific therapy, and hopefully we will come to, because we now say that 30 to 50% of the diseases are genetically based, or those are inherited. And some of those diseases which will, from idiopathic, will turn out to have some etiology, and the treatment will be more specific. And that is my, I think, prediction that will happen. Something which was observed for thousands of years, and now we have the testing of those gene analysis, and the disease will be accordingly treated with the appropriate medication.
Thank you very much.
My answer is lifestyle. And that will prevent a lot of diseases. By lifestyle, I mean even you can change your genes also. I have been saying that you can't change genes, but now the new evidence is you can even change genes with lifestyle changing, and you can prevent a lot of medications and a lot of diseases also. By lifestyle means that no stress, no smoking, control hypertension, control diabetes, control weight, control cholesterol, and most of these things are dependent on the diet. So, and the other thing is the greed in the world. Stay away from the hospital, and stay away from the doctors, and stay away from the attorneys.
Right. Thank you very much. Thank you all. Hey. Let me give you something for happiness before we finish. Chinese proverb. If you want to be happy for an hour, take a nap. Happy for a day, go golfing. Happy for a month, get married. Happy for a year? Ladies and gentlemen, money can keep you happy only for so long. You can't sleep, eat, or drink money. But if you want to be happy for a lifetime, go help someone else. Thank you very much.